Just get straight from you, your assessment of AstraZeneca, its rollout in Australia and its safety for the population.
Well, AstraZeneca is a very good vaccine for stopping people from dying and getting really sick and getting into hospital. Everywhere around the world, even with the variants, it's been very effective. So where it really is needed and where we really have to make sure it gets rolled out in Australia and we don't stop it in any way is what's called the phase 1B group currently, which is predominantly people over the age of 70, because they're the vast majority of people who die if they get COVID. If you're over the age of 80, you've probably got maybe a 1 in 10 chance of dying if you actually get COVID and get infected. And that's compared to probably a risk of 1 in a million of death from getting a clot from the COVID vaccine, or 1 in 100, 1 in 250,000 of getting one of these serious unusual clots. So the balance of benefits versus risk is so much in favour of having an AstraZeneca vaccine if you're one of those higher risk groups that you're silly not to have it. Now, you can argue we don't have spread in Australia, and that's true, but we could easily have it, and at some stage we're going to have to open up and we will have more spread or more risk. So we absolutely need those people vaccinated, and we need them vaccinated before this winter because that's our next big risk period. So we've got about 2 or 3 months to get quite a number of millions of people vaccinated, in my view, at least with the first dose. Now, why this 50-year cutoff? Well, perversely, it's because Australia has been so successful in stopping any spread. Because what it means, if you're a 20 or a 30-year-old, where your chance of dying of COVID is maybe 1 in 10,000 or less, if we have no spread at all, it means your risk of dying of COVID is actually so small that a very remote risk from a vaccine may outweigh that benefit at the moment if there's no spread. But equally, if you look at all the people that they're worried about, they're not in line to get the vaccine in Australia unless they've got an underlying risk factor for at least another few months. And we'll have a lot more data by then, and we'll probably have a lot more alternate vaccines if we need to give it. So I think there is a lot of hysteria about this because the only people this really affects are maybe healthcare workers who are, 40 or 50 and may need to get vaccinated, some people with underlying illnesses. But I would think we'd have enough Pfizer vaccine available to do those people. Now, that may mean they've got to come to a special government clinic instead of their GP, but I don't actually think this is a problem, providing we keep good control of COVID in Australia, which we have done for the last 6 or 9 months.
Well, spot on. I'm so pleased to hear that because I'm not going crazy. Just on all the evidence, all that we've heard from you and other experts over many, many months, that's my reading of this situation. I mean, AstraZeneca, we're producing it now here domestically. We're rolling it out at 80,000 a day. We can ramp that up. And it's got to go to the elderly first, and there's not the slightest hiccup in that. That's got to just accelerate rather than be held up at all, right?
Yeah, look, they're the group that are most at risk, but also less of risk of getting these side effects. If anything, they may occur more frequently in, say, 30 or 40-year-olds than 80-year-olds. But, the group that is at risk of dying, we need to get vaccinated because while we hope we keep control and we don't get, much spread in Australia, we can't guarantee that. And so we need to protect the people who are most at risk. And all these issues or statements saying, oh, look, why don't we get other vaccine? We need to get real. Australia should be not the front of the queue for any of these vaccine rollout. We do not have spread here. There are a lot of countries more deserving than us. And even if we're rich and have a lot of money, I don't think we should buy our way to the front of the queue. Equally, however, we know who's at risk in this country more than anybody else. We have locally produced vaccine that works, that stops you from dying, stops you going to hospital. We need to roll that out to all those people very efficiently. 1 million doses, a week need to be rolled out over the next few months. And yes, then work out what we're going to do with the others who may be at slightly increased risk of a very rare side effect, but not compromise a vaccine rollout with, I think, too much politics and unrealistic expectations about we can suddenly magic up a whole lot of billions or millions of more doses of vaccine.
There is so much nitpicking and politicking, and without diminishing at all what you've said very emphatically about the need to speed up the rollout to our elderly population. About 6 million elderly Australians need to get it before winter. But aside from that, you've introduced a very important part of this debate, and that is, apart from the hysteria, it's the selfishness. It's the pretense that somehow a healthy 30-year-old in Australia, where there's no community transmission and where there's no risk to that person, somehow deserves the vaccine more than someone who's in North America or Northern Italy and the disease is running rampant.
Yeah, well, look, you can argue that the Europeans shouldn't have stopped those 3 million AstraZeneca doses coming to Australia, in the last month or so. But you can also see that Europe needs it more than us. And that's particularly relevant after we've done the first 6 or 7 million doses. Yes, we want everybody eventually vaccinated because it gives us more protection and we can get back to life as normal if something goes wrong. But I think we've got a moral obligation to look at Papua New Guinea, other areas of the world. And I think it's more important that we get over 60-year-olds vaccinated in those countries than 20 and 30-year-olds vaccinated here. And equally, children are not going to have a vaccine available till early next year, at the earliest, in my view. So we're not going to have full protection for everybody for quite a while. So I think we need to calm down a bit, have some confidence we're going to keep good control, but we need an insurance policy for the most vulnerable, and that's the 6 or 7 million people that we can now easily vaccinate, given that we're making AstraZeneca here, and then just see what unfolds. We're in the unique position that we never had to rush this vaccine. And you can see with this AstraZeneca, perversely, it's worth, tens of millions of people being vaccinated somewhere else. So we can look at rare side effects and make a balanced, hopefully appropriate decision on, well, we'll restrict it a bit more to this group, but the vast majority of people are still going to get it, and learn with more data as it unfolds and not panic and not rush into this. Exactly
the advantage you were telling us about some months ago. Thanks again for joining us, Peter. I appreciate it.
Thank you.